Hello, everybody. GrowthRx community, osteopaths, allied health, all practitioners all over Australia, but predominantly here in Victoria. There is a lot going on down here. So whether you're watching from the grandstands, thankful that this is not you. There's a few of us playing the game down here. And I call it a game, and I'm not to do that patronising, but it's because this is ever changing. And I feel like myself personally, there's a wrecking ball coming through in what is luck, what is this horrible situation. Some people are affected by it, others aren't. And for the first time here in Victoria, we have seen these restrictions at stage 4 severely affect us. There is a huge amount of confusion going on, which is why I am joined here today by our CEO of Osteopathy Australia, Antony Nicholas. Welcome.
Welcome, thank you.
I know more than anybody, and our industry does know just how busy you are right now. So to take this time out of your day to talk to us, I and many others are so grateful. I know that there are a lot of physios, chiros, podiatrists, EPs in this group. This does collectively affect all of us in Allied Health. So whilst you are definitely speaking on behalf of Osteopathy Australia, I definitely suggest that this is not to go against your own associations, and you seek the advice of your own associations and legal advice here, and the advice of the DHHS, governing bodies, and the federal government. I need to make that really, really clear. We're talking to you and we're communicating you in our efforts of doing a favour for the most part for everybody. Look at me today. I am at the clinic. I'm scrambling. I'm probably 2 days off, no sleep, navigating a big and wonderful team who are all very scared. But we have just had some updates, and from what I can understand, Antony, you've just come out of a meeting that is very important.
Yeah, so basically several of the associations met with DHHS this morning and their Chief Allied Health Officer to try and clarify the swamp of information that we're getting. So I suppose the take-home message is the earlier restriction around GP referrals being needed for every appointment has been removed. However, they have said that routine treatments are not permitted, and there's that criteria around urgent and emergency appointments that still needs further clarification.
Okay, so one of the things we can clarify though is that there are certain businesses out there that are fist pumping and high-fiving and business as usual. You know, this is certainly not business as usual. We are in a state of crisis here, particularly in Victoria. And for the most part, they are trying to stop touch points, traffic, movement, and transfer of this highly contagious virus. So there's certain implementations being put in, and the referral from GPs was one that, from my understanding, they were trying to govern what is urgent and what conditions would seriously deteriorate in the event that they didn't seek that treatment. Now, some of this is going to come down, whether we like it or not, to personal judgment. Personal judgment of a patient, whether that deems that they need that ongoing care, personal judgment of a practitioner, and also that of a referring doctor who potentially might be questioning that. A lot of this comes down to confirmation bias, which I'll talk to a little bit later when we kind of lose you here. But can you talk to me a little bit about people's perceptions of this, and can we make it really clear what it is that they're saying?
Yeah, I think the message that was put through to all the associations really strongly was that this is a pandemic. The point the government has brought in these restrictions is, exactly as you said, to absolutely minimise as much movement as possible, as much face-to-face interactions with anybody as possible. And so the restrictions are really around making sure that what's required to maintain people's health deteriorating in a serious way will still be eligible, but all those routine appointments or the worried well, or I've got a bit of back pain, or probably even I've sprained my ankle, but I know if I get some advice I can deal with that, are out. It really is what they're trying to say is their mantra is reduce movement, save lives. Yesterday, 700 plus infections. So we're nowhere near the peak yet. And so I think we have to accept that the department is going to take this very seriously. And if it doesn't work, they will bring in further restrictions.
Okay, so the wording there to clarify, and we do have clarity on that, is that the services must prevent a significant change or deterioration in functional independence, necessitating escalation of care. So it is a requirement that they need this care in an effort to avoid hospital admissions or emergency department admissions. That is the wording that we've been given today, and the clinical notes need to clearly reflect this.
Yeah, so we've asked for further clarification on what sort of documentation both patients may need, but clinicians will need, and they said they're going to release further information on that. But clearly, there is an intention that if someone's investigated or a complaint is lodged, you will have to be able to demonstrate why you believed every patient you've seen through this 6 week period met that criteria.
Okay, so I know, and I've spoken to many business owners over the next couple of days, you know, there's a lot that have, whilst we're seeking clarity, they've closed over the next 2 days. There's a few people that are kind of running and asking patients, do you desperately need this? Is this something, is your condition going to deteriorate? They're suggesting that if telehealth can be done, that is the first point of call to reduce that face-to-face contact. It's very clear that 14-year-old Johnny who has a sprained ankle is no longer going to be treated face-to-face in the room anymore. And outside of that, I guess there is an element of discretion, but we're still trying to find out what amount of evidence needs to be supported, if it's not a GP referral, that this is an urgent appointment in regards to that deterioration. So I think we probably still need to get more clarity on this. There does...
Sorry, go on.
Yep,
Certainly
no.
When I asked about the patient documentation or the clinician documentation, when they said they're still working on it, I said, well, what would be the department's expectation if a patient said it was urgent, but when they attend, that it's clear to you as the clinician it's not, and their response was, we would expect you to turn them away.
Okay. And that was the wording from the DHHS meeting, is that we, as healthcare professionals, have a duty of care to assist the Victorian government with enforcing this. And it is beyond just us missing the wrecking ball coming through and keeping our businesses open. There is a very clear line that these need to be urgent cases.
Yeah. I think clearly it's not business as usual. As much as we would all love that it was business as usual, it's going to have a huge impact on every allied health business. Certainly many of the self-regulated professions have had even stronger obligations put on them, to the point some will be incredibly restricted in what they can do.
Okay, so whilst prior it was noted around a GP referral, and that, you know, a lot of these GPs have no idea what's going on with our patients, with our care, with our management, what we intend for them for their future mobility, that onus was put onto the GPs. It's now been removed and put onto us to determine what is urgent or not. Is that correct?
Yep, basically. Ultimately, the department is trusting and heard the associations say that you are primary contact practitioners with those skills, and now basically you will be judged based on those clinical skills, that if you can't follow these public health directives, and remember, these are pieces of legislation, not just political wishes, they are pieces of legislation, that they are now putting that onus on you as a practitioner, that you need to justify that your patients have met this criteria.
Okay, but we're yet to know how this is going to be governed, whether it be through clinical notes, audits, or...
Yeah. I think more than likely, they don't have the resources to do that in a pandemic anyway. Yep. I think it's more likely, as we know already with advertising complaints and conduct complaints, it will come from your competitors down the road.
Okay. So we can confirm that a GP referral is not necessary for allied health practitioners, but we need to act in accordance with and reflect the new criteria.
Correct.
Okay. So routine treatment and non-urgent treatment are not permitted at the moment.
Not face-to-face.
Okay. So we need to use, as professionals our clinical judgment to assess patients' needs at the moment. Okay. And obviously in regards to PPE, that still entails all of our usual escalated hygiene measures. All of those sorts of things are still going to continue.
All in place. DHS has just released a new Allied Health PPE fact sheet, which I was frantically trying to find the link before I came on here, but they have released a one for Allied Health private practices.
Yeah, but the definition of urgent at the moment to give us a justification or documentation of what urgent, I'm assuming that communication is going to come.
It is, but in the meantime, we would go on the fact that, you know, for example, a requirement for a specialist input review, an increase in case needs, avoiding hospital admission. Certainly the example DHS kept using in the meeting we were all having with them is urgent is that if they don't get this treatment, they may end up at A&E.
Okay. So what about the criteria for non-AHPRA professions that have do they have a stricter criteria I guess they don't have those diagnostic means, myotherapist, remedial massage, Pilates instructors? How does that fit into this?
So basically what they've done with the self-regulated professions, and because of course we don't govern them, I didn't pay quite as much attention to those bits, but there are certain professions they've clumped with the AHPRA professions. I'm just trying to see if I've still got the spreadsheet open. Which I don't, unfortunately. But the spreadsheet they released at midnight last night, which had the different professions in the definition there. What they've done is they've announced some of the self-regulated professions like dietitians, speechies, etc. They've just clumped with the same conditions as the AHPRA registered. And then they said the others need to either meet the criteria to be the sorts of people that can be referred DVA, TAC, etc. But if any of the professions outside of that are effectively stopped.
Okay.
So for instance, EPs, exercise physiologists were saying, but you haven't listed Medicare in that list, and they haven't. They may not be able to conduct certain things. So we're really not sure what that means for, say, myotherapist.
Okay. So, and while I still got you, I know you've got to duck away soon. There's a ton of other questions. I'll try and get to a few of those. Just really quickly, obviously urgent. We know this to be life-threatening and all the rest of it. There is certainly a criteria for chronic pain, fibromyalgia, chronic pain associated with mental illness. Where do we draw those jurisdictions from? There are certainly people where their mental condition is going to deteriorate without musculoskeletal care. Is that a grey area for us at the moment when it comes to defining urgent?
No, I think it is that matter of you are going to have to use your clinical judgment. And I don't think, you know, we have to beat ourselves up about this. I do think it is that matter of where is the patient at? What's the likely impact to the patient in a serious way that could impact them if they don't get trained, especially for, you know, persistent pain patients or where you're worried about their mental health. They have really upped the number of mental health items that people can access. So it probably is going to be around some of that referral as well for those patients. Okay. But I think it's really going to fall down to how you justify that the person met that criteria.
Okay. And if this does fall out of our hands as individual practitioners to decide what is urgent and it does come through with a GP referral, does a GP referral override our need to determine urgent or not? Has that classification come from another allied health professional or GP or specialist with a referral, whether it be DMA, work cover, TAC? Have we got clarity on those patients?
No, we think that obviously patients, again, you're going to have to do that assessment of they've already got that referral, but is their treatment in the next 6 weeks urgent or can it be delayed? Or I think one of those difficulties will be around, well, they may need one treatment, but is that going to be justification for them having 4 treatments through the 6-week period? And I think clinicians are going to have to
one-off treatments and treatment of a duration of a consistent nature weekly over the 6-week lockdown.
Yeah. So I'd say that, you know, if you honestly believe they will need 5 appointments over that period of time to stop them presenting at A&E or etc., then you'll need to justify that, but you may need to justify that.
So things like rehabilitation, whilst that's not life-threatening, it may affect activities of daily living that are going to keep people active and mobile throughout, or could be detrimental during this period of time. So things like rehab-based Pilates, exercise physiology, those sorts of things could come into play here at practitioner discretion in regards to deterioration of a condition.
Yep. And I think, I think the message that came through to us again and again is, obviously there are no restrictions on telehealth items.
And have we got an update on where allied health professionals stand with Medicare rebates for telehealth at the moment? Has that been lifted?
Medicare rebates for chronic disease items are still in place for allied health. Yep. But no, certainly for osteo, there is no private health insurance rebates. Obviously in Victoria, TAC and WorkSafe also allow telehealth. DVA allows telehealth, so yeah, but private patients full fee.
Okay, and I guess there's a couple of other little questions that might be applicable. You might not be able to answer when it comes to the travelling for a patient. Once upon a time, this was proof of travel for medical reasons outside a 5-kilometre radius, or perhaps after a lockdown period. Do we know that we fall into that as allied health professionals as medical, so people can travel with proof?
It was one of the questions where they said they are still seeking clarification, especially around the travel movement between 3-4-4-3, but also over longer distances. They did say that they expect, effectively, I suppose the overriding principle is the minimal movement, and that's going to have that consequence. They did say, interestingly, when they were talking about patients, so they almost delineated that existing patients who are outside the 5K zone probably would still be okay because they are existing patients if they meet that criteria. But a new patient outside that 5K zone probably needs to find a practitioner closer to them.
Yeah. And so some of this screening for urgent could be done as a telehealth appointment first, and then you could transition across to that face-to-face if needed, or we've done triage, for example, over the phone. You've got admin. I know our admin team at the moment are triaging calls and asking them about the level of deterioration if they didn't seek care today, whether they have got a referral, how urgent this case is. There has to be a triage process. Is this something that we would put into our COVID screening as well?
Yeah, I think ultimately everyone should be maintaining their COVID screening, but now you're also going to have to add a bit of, urgency screening, because ultimately if DHSS is saying if a person shows up and it's not urgent, you need to send them away, well, then you want to make sure that you're not wasting their time and your time in that pre-screening. So I think it's that either telehealth appointment prior or required first, or at least some sort of screening.
Yeah, and we're having that word urgent come up all the time. There's a lot of people jumping into this live. We are still waiting on clarification of the definition of urgent. We do also know, is that confined to metro stage 4 restrictions, or is that outside into stage 3 and beyond that rural barrier?
It's obviously these are the Melbourne stage 4 restrictions. Yep. Most of the rest of Victoria in stage 3 are sort of required to do what was required of Melbourne up until a week ago. But there are some added components. So the PPE is for everybody. The pre-screening should be for everybody across Melbourne. We're unclear that what's the requirement for a practitioner who may be travelling from 4 into 3 to work, and likewise for patients.
Okay, and so just on that really quickly, you've all of a sudden, you're a patient whose clinic has shut down in Metro Melbourne, and you think, hey, great, I'm going to book in with a physiotherapist in Geelong now because they can see me. What happens in regards to that travel, I guess, if it is deemed outside that 5-kilometre radius? I'm assuming it would only be for regular patients to be able to travel?
Yeah, I think it's basically existing patients, new patients will have to work out who the health practitioner is closest to their location. Yep. Within hopefully that 5K zone. And one of the things DHS said, which will probably inflame lots of professions, was Well, if you can't get into, I'll use osteo as an example. If you can't get in to see a physio within your 5K, then you may have to choose the osteo within your 5K, or the chiro within your 5K, or your myo within 5K to make that possible.
And there's an important note on that I just want to bring up. Someone mentioned in the comments, when I mentioned triage before of reception, which is a great point, should that triaging of urgent cases really should be done by a practitioner? It shouldn't be left to reception?
Well, I think ultimately the judgment is going to be the clinicians. So if you if something goes wrong and the patient isn't as urgent or whatever, the judgment is still going to be yours. So I think every clinician has to work out whether they either have a good enough screening process that informs their clinical judgment, or unfortunately they may have to be doing some of that screening themselves so that they are confident that
So it needs to be a mutual conversation between a practitioner and a patient to best determine the likelihood of the need for that consultation, and not just done based upon, I guess, the patient's interpretation of their need.
I think a bit like advertising, you can't outsource it to someone else. Ultimately, you always will be responsible for it. And I think here the same. You can't outsource your clinical judgment.
It's a really important point. What people are advertising on social media now, these posts to notify their patients, be very careful what you're posting and what you're transferring and how you're framing it to your patients until we seek more clarity on this definition, is what my advice would be. Would you agree with that?
Well and truly, and how easy it is, I've seen already in one of our discussion forums, dozens of screenshots of other people's advertising where people are sort of having a laugh, but also trying to work out what people are allowed to do or not. That's how easy it is to lodge that with either the department or AHPRA for being probably a breach. So I think if we want to be deemed as primary contact health practitioners, let's act like it and let's advertise like it.
Yeah, and we have a duty of care as health professionals to guide and support the actions of what our governing bodies are doing as healthcare professionals. So I think it's beyond our own confirmation bias in wanting to keep our businesses open. Every single industry in Victoria right now wants to stay open. It's not about finding loopholes, it's about doing the right thing.
Yeah, I have, sorry, go on.
You know, we very clearly can stay open. We don't have to close, but there are restrictions on who we can stay open for.
Yeah, and that was going to be I think we were left of fairly clear that they're doing what they can to keep Allied Health open in a pandemic, but they also probably have no qualms that if the rules are going to be flouted and they have to go to higher restrictions, then they have to go for another option. And that will probably mean closing businesses down altogether.
Okay, so if you are caught out, they would very happily come in and shut your business down if you're seen to be doing the wrong thing.
You're in breach of a public health order. I think, you know, not only that, they're probably going to refer you to AHPRA to see whether you've breached your professional conduct.
Yeah, okay. There's definitely a few other things that I have been researching this morning that I'm going to deliver straight from DHHS. Did you want to say anything before you need to duck away?
Thanks for the opportunity. Look after yourselves.
I wanted to say thank you very much on behalf of Osteopathy Australia. A lot of people don't know you. They don't see what you do behind the scenes. I've had a lot of contact with you over the last couple of weeks, over the last couple of months. I want to say on behalf of everybody, I made a post yesterday, we do salute you. We thank you for your work. I know how tireless this is and how very little sleep you have. I know the BS that you also have to put up with and fleece, and that this is ever changing and you're on top of it all the time. So we are really grateful for you. I think everybody is grateful for their associations, but I can only speak on behalf of other members of Osteopathy Australia. If you are not a member, do it this afternoon, do it yesterday.
Great. Probably my parting on something positive rather than fines and prosecutions is probably, this is what associations are here for. It is sort of, you don't want a crisis, but this is what we're here for, because collectively we can help each other out in these tough times. And that's the whole point. So, and that's what excites me, is the many minds putting in to make everyone's work a little bit lighter.
Yeah. And I do want to make clear that, this is the position of Osteopathy Australia. certainly the APA and the ACA, you need to speak to your governing bodies and get the direction from them. This is not for everybody. It is just an opinion, it's just guidance, but it is also certainly a very recognised association, and your opinion should be seen that way. So thank you very much for your time, Antony. I will continue chatting to everybody else. I've got a few more things that I'll cover that I've researched today, but thank you.
Thank you. Thanks, everyone. Take care.
So I will continue on with a couple more things. I've got a few notes here in regards to permits. My actions now on speaking to the rest of you are certainly not going to be opinion-based. They're going to be facts that I've taken from the DHHS and just some questions that came through the forum this morning. Some of it was in regards to communication with GPs. There was a lot of people that were kind of scrambling to get referrals from GPs. Again, we still don't know the stipulations and classification behind what urgent is, but I would say that this has certainly been passed on to the RACGP, and that they will be delivering this and making their own interpretations of what that is. But if you've got great relationships with GPs, you know, now is the time to lean on them so that perhaps they could start doing some of this triaging process for you. Communicating with your patients, again, being really careful about how you communicate. I would be saying now that if you have got a team of staff, that patients are called individually, and you start this process now. I can only speak for our clinic, but we are calling all of the patients that are booked in for the rest of this week, talking to them about where they're positioned, having those case histories over the phone, having those open and frank communications that, you know, is their health at risk here, whether it be mental health, their physical judgment, and then outside of that, trying to keep people out of urgent situations, stopping people and trying to take on the demand that GPs are facing right now, that emergency places are facing right now. If you get that horrendously acute condition that you could otherwise steer away from needing that urgent care, or if you've got somebody really suffering with chronic pain, mental illness, who has been getting and seeking regular care for a long time, that this doesn't also just stop in its tracks. But this is a very independent conversation that practitioners need to have with their patients, who they can make the best judgment for. In regards to those travelling requirements, we still covered a little bit of that now. One of the situations I have, and I don't know why this continues to happen to us, but we have a clinic in stage 4 lockdown at our Melton location, and our Bacchus Marsh location is in stage 3. We've got patients, a lot of patients that travel between the two locations, and obviously therefore across the border. I made a call myself to the head of border crossings from the metro to the rural area. I spoke to him directly this morning. I won't mention his name, but I had it on good advice that they just don't have the manpower at the moment to be passing all of this information on. And he has said that it does come down to a lot of clinics' discretions when people are travelling from metro and outer. At the moment, within their knowledge, they are told that proof of an appointment at the moment to show travel beyond a 5-kilometre radius or outside of a metro is enough to allow people to get through those border passages. I'm really sorry, I don't know what that looks like at more of a state federal level, crossings between Victoria, New South Wales, Albury, Wodonga. All I can say for you right now is I really, really feel for you. Not only are you in a whole different kettle of fish, I think that there's certain jurisdictions that I'm not aware of right now, so I can't necessarily comment on that. When it comes to travel for work, we all know now, it's all been made really, really clear that permits are needed. This was effective from last night. These can be downloaded. There's 2 permits. There's a worker's permit, and there's also a permit scheme for childcare. These are 2 different, they look very, very similar, but they are different. So if you are still needing childcare and daycare, you'll have to talk to your own personal daycare or childcare about what the requirements they're needing. But I have seen those forms. When it comes to the permits, it's really, really important that individuals know that they must have a permit and photo ID on them at all times. And these fines can be huge for 2 reasons. If an individual doesn't have a permit on them, it's an individual fine of $1,652. That also falls back on the company, which is $9,913. So if you've got a worker that happens to not have that permit on them, they will get fined, and the reality is you could also get fined too. If one of these schemes, these permit schemes, has been filled out fraudulently, which is not going to be the case with us, thankfully, there's an individual $19,000 plus fine and a company fine of up to $99,000. These fines are huge. So make sure that you've got a copy on you, in your handbag, in your glove box, in your car. Keep it with you everywhere you go, because the fine doesn't just fall back on you, it falls back on your company and the business that you are representing at the time as well. So that's really, really important. They can be found on justice.vic.gov.au/permitted worker scheme, and there's also a special one for childcare at the moment as well. Practitioners working at multiple locations. Again, yesterday there was a strong suggestion that employees should not be working at multiple locations if this is possible. Now, I think a lot of this definitely related to physios who perhaps were working at different nursing homes, for example. But in our instances here, we've got a lot of associates, we've got a lot of contractors, and we've got a lot of employees that might work 2 days at one clinic and then 3 days at another. So what happens here is this can continue, but it needs to be recorded in a log. Now, obviously, consultation times can be deemed as evidence to support the movement of a practitioner, but they will definitely be seeking a log to assist with tracing. So again, this has come from some of the DHHS advice that where possible, do not mix locations. So I know here at the moment, I can navigate and I can coordinate what my team are doing. There are a lot of clinics out there splitting clinics into teams. So certain employees or associates only working together Monday, Tuesday, Wednesday, and then others not crossing paths working Thursday, Friday, Saturday. So if it is different locations, that's difficult. This is because if somebody comes up with a positive case at one location, if they have been to your location, both locations will need to close down for deep cleaning, or this is also going to have a roll-on effect with people who need to isolate, whether that be then what happens at one clinic then rolls on and affects at another, simply because somebody has crossed into another place of employment or another workplace. So that's really, really important. If you can split teams, the recommendation is to do so and have very little practitioners crossing paths. This is very different to somebody being on location. I know that we're not meant to be around people as it is. So let's just say I've got somebody who comes into work, they do nothing but come in, sit in their room and leave. They have still been in that workplace and done the exact same thing at another workplace. So the advice that I've been told at the moment is that both clinics would need to close for a deep clean. This doesn't mean that people they haven't been in contact with need to isolate, but deep cleans, which might take 1 or 2 days, is still going to detrimentally affect patient appointments, moving of patients, and a lot of that policy and procedure systematized type stuff. So if it can be done, then, try and avoid that. So there's been a few other questions and stuff come through. I am just one little person trying my best. This is me today, hair not done, makeup not done, running off no sleep. I'm doing this to help you. I certainly don't want to be attacked for delivering the wrong message. So I would rather you ask me personally or ask your associations if I have got something wrong. I genuinely apologise. I'm just trying to research and transfer and communicate so that we can remain a little bit calm in these times. But one of the things, I guess, when it comes to leadership, that's really, really important at the moment is the dissonance that we're feeling right now. Dissonance comes from conflicting beliefs, behaviours and actions that we're not sitting comfortable with right now. We are all struggling with an internal battle between helping our businesses survive, the livelihoods of our practitioners and those we care about and those that we work for, and keeping them safe, and also being able to provide care to patients who desperately need us. We are highly empathetic and compassionate people generally in nature. People who end up in healthcare are in this position because we have big hearts. We want to keep our team safe. We want to keep our businesses safe, our livelihoods secure and safe, and we want to be able to provide good, high quality care. So we have these internal battles at the moment. What we don't need right now across our industries is judgment and pointing fingers and making people feel worse than we already do. It is really important that we continue to bind together now. And I love the GrowthRx platform. I've had a lot to do with osteopaths and the beautiful profession that is. But connecting strongly and making relationships with physios and chiros and EPs and considering us all under this Allied Health umbrella is a really, really beautiful thing right now. We are all going through the same thing because our common ground is to help people. That is what we do, and that is where we are all aligned, and that's where we connect, and united we are stronger in that. We need compassionate leadership right now. We need camaraderie of teams and staff to come together, and we also need to listen to the advice. This is not about turning a blind eye and doing what works best for us and best for our practice. This is bigger than ourselves, and whilst we might have missed out this time and we don't have to close, this could change in the next 24 hours. This could change tomorrow. This could change next week. And as I always say, be prepared, because if you are prepared, you're not blindsided. And panic usually stems from fear. So if we have a plan A and a plan B, and a plan A and B for our plan B, then what we can do is just communicate this, talk to our teams, talk to our patients, and follow through. But more importantly, our mental health right now is really, really important. We need to ask for help. We need to support each other. And if you are struggling right now, there are certainly professionals out there that you can talk to through telehealth. But even just leaning on each other and making sure that everyone is okay in times like this and just reaching out to people. What the next 6 weeks holds for us here in Victoria, we don't know. We are at the very, very beginning of this. And if numbers don't come down, then these restrictions are going to increase. And we might be told that it is absolutely irrelevant. This happened, in the UK, it was kept open for urgent cases. There were other countries like Italy that just had to close down altogether. We don't know what's going to happen as numbers increase. So our future challenges are going to be day by day and week by week, but we can all continue to advise each other. Managing patient numbers right now, next week for us, what is front of mind for me is I don't know what that looks like. I can't tangibly look at all of the patients that are in next week and know how many of them offhand, whether it be 20% or 30%, are deemed urgent. I think what we need to start doing now is making phone calls. We need to start digging deep, and the hustle and grind comes from picking up the phone and communicating with each and every single one of our patients. And I think everybody needs to be invested in that, regardless of whether you're on JobKeeper or you're not getting paid. This is about support. And if you have to work overtime and make phone calls, if you have to come in the morning and make phone calls, if your clinic is closed and you have to make phone calls from home, this is what we do right now to make sure that we are a point of contact for every single patient moving forward, whether we know then when we have to transfer people to telehealth, who is urgent, whose conditions are going to deteriorate if we don't see them, and then start from there. If we then need to go down that HR and those employment, reduction of shifts, reduction of hours, changing contracts of people and go back to what we did back in March, then that's what we need to do. But I think if nothing else, people are understanding right now. And as long as you communicate openly, effectively, and with the utmost sincerity and empathy behind it, with a big heart, knowing that everybody's struggling right now, people will rise to the occasion. So I hope and I care for everybody dearly. I'm sorry if I have missed some questions. This is really hard for everybody, and I am such a compassionate person. There's a lot of people that judge me who don't know me, but at the end of the day, my care and concern is for everybody, for the professions that we love, and for our patients. And I will continue to do everything I can to communicate that. And if I haven't today, then please shoot me through some other messages. I'll liaise with people that I know. But moving forward from here, the next couple of days are going to be tough. Next week is still going to be a little bit of unknown, but at least we now know moving forward, our biggest decision right now is how we personally define what urgent is. and that's what will indicate where our next actions come from. But again, there's no judgment. It's just to kind of sit there and just start actioning that. So outside of that, thank you everybody for your time. This has certainly been something that has been a hot topic and has interested everybody. For those of you watching outside of Victoria, thank you for your thoughts. Thank you for your concerns. We are doing okay here. We will be okay. And if we do get through this and this does happen to affect you in the future, then at least we've got some policies and procedures and systems in place that you can mirror and act on accordingly, and you won't have to scramble, hopefully. So thank you everybody else. I think we kind of got on and off over about 150 people over the last little while. I'm sure people will tune in on this after. Thank you for the care and support that you've given me. Thank you for the feedback, and we'll just keep going. I'll leave you to it to enjoy and scramble and coordinate the rest of your afternoon. Thanks very much.